Hello, and welcome to our Surgical Technology Information Session. In this information session, you will learn more about our MCC Hartford Hospital Surgical Technology Program, what the role of the surgical technologist is, where you can work as a surgical technologist, how you can advance your career in surgical technology, and how you can get from today's information session to an associate's degree in surgical technology. I will be sharing a great deal of information in a relatively short period of time, so I hope you have a pen and paper to make a note of any questions you may have after this session. I would encourage you to send your questions in an email to me so that I may respond to your individual inquiries. My name is Terry Kennedy, and I am a certified surgical technologist and the director of our MCC Hartford Hospital Consortium Surgical Technology Program, established in 2017. This partnership was formed to provide the best possible surgical technology education to our community college students seeking a healthcare career in the surgical technology profession. The college teaches the non-core general education courses, which is their area of expertise. And on the Hartford Hospital campus, we teach the core surgical technology courses. We also use the Hartford Healthcare System facilities to provide clinical experiences for our surgical technology students. The role of the surgical technologist has existed for decades and has been fulfilled by medics, corpsmen, scrub nurses, hospital-trained OR techs, vocational school-trained surgical technicians, and most recently, associate degree surgical technologists. The title surgical technologist, more than any other, best defines our role and our professional place in healthcare. Our most prominent place of employment is surgery, also known as the operating room or OR. Our role: assist the surgical team using our technical expertise to provide the best possible outcome for the surgical patient. Let's break that down a little bit further. The surgical technologist's role is centered on what is practiced and referred to as perioperative. This includes 3 phases. Pre-op, where the surgical technologist prepares the OR for the surgical case by setting up instrumentation and equipment required for the procedure. Once the procedure begins, we are in the intraoperative phase. This is where the surg tech, ST, surgical technologist, scrub nurse, all of those titles we get, assist the surgical team handing instruments, counting surgical needles and sponges, and making certain that a sterile environment is maintained. The post-op phase is when surgery ends. During this phase, the surg tech is responsible for assisting with the patient's dressing, disposing of soiled items, decontaminating instruments, getting them prepared to be sterilized, and then repeating the process for the next surgery. You may already have known some of what I just told you. However, you may have some misconceptions of the surgical tech created by the fictional depiction of this profession on TV. So I'd like to take a moment to share what may be considered the pros and cons of this profession, which may help you decide if this is a good career path for you. As with any healthcare career, surgical technologists may work long hours, weekends, holidays, and are often required to be on call for surgical emergencies. Now, don't get me wrong, there are coffee breaks and lunch breaks and days off. However, these are expected to be taken around the surgical schedule. If the OR is busy, you may get your lunch at 10:30 in the morning or 4 o'clock in the afternoon. Surgery also brings with it many interesting, strange, strong odors and bodily fluids. So if you have a difficult time with such things as these, the OR would be a difficult place for you to work. I often tell my students if they're in a very difficult, very odorous case, to put a little Vicks under their nose and inside their mask, at least for the first half hour or so, it doesn't smell so bad. It is also important when working in the operating room to be a team player, as everyone works together for the good of the patient. If you are more of a solitary worker, do things by yourself, take control, or maybe wait for someone to tell you what to do, this may provide a significant challenge for you. Every day, every surgery, every patient is unique and provides an amazing education for the surgical technologists to advance their skills. But it doesn't have to stop there. Surgical technology education opens the door for a multitude of healthcare careers. Hospitals often offer surgical technology career ladders, which afford the surg tech the opportunity to grow within their profession at their location. Many surg techs find their educational background is a great base for further education and can, with additional training, become first assistants, physician assistants, nurses, educators, and yes, even surgeons. Other ST students scrub over 120 surgical cases. This is the minimum requirement, and all of our students are required to scrub this many cases to make them eligible to sit for the National Certified Surgical Technologist exam. When the surg tech successfully completes this exam, they are certified to work anywhere in the United States. This is important, as now the surgical technologist is provided the opportunity to become a traveling surg tech. They can work anywhere in the country. This includes such things as ORs in the hospitals, surgery centers, emergency rooms, specialty procedure centers, and even doctor's offices, and acting as private scrubs. Over the next 5 years, there is a 12 to 20% growth expected in the profession of surgical technologists. We are very proud of our program's success, with 90% or more of our graduates each year successfully passing their CST exams, and 100% of our graduates being offered employment in the state of Connecticut. This is outstanding work on behalf of our students. So, how do you become a surgical technology student in our program? All of this information is outlined in great detail on our program pages on the MCC website, and I would encourage you to review this information. Basically, admission to our surg tech program has multiple steps. First, before making application to our program, you must demonstrate successful completion of 34 required non-core course general education credits. Successful completion requires a C grade or greater. If you have taken college courses outside of MCC, you can request a transcript review by admissions to see if any of those qualify for transfer. Once you have completed these required courses, you can submit a surg tech career application. If you are a first-time college student, you can register and begin taking these courses towards the goal of gaining admission to our surgical technology program. Applications are accepted from October 1 to February 1 each year. All applications must include official college transcripts. They are reviewed after February 1. Those applicants who have met the preliminary requirements stated above are invited to take an entrance exam. This entrance exam is a written comprehension exam. We offer this type of exam because as a surgical technologist, you're often faced with the challenge of reading documents, reading directions, and having to assemble or follow standards based on those instructions. So this is key to the success of our surgical technology students. Surgical tech applicants who are successful to a degree of 70% or greater on this entrance exam are invited for an in-person, oral, and written interview. The Surgical Technology Program Selection Committee makes the final decision on which ST candidates are offered fall admission. At present, we offer admission to a maximum of 10 surgical technology students each fall. Our surgical technology program is a full-time day program. Classes are currently offered Tuesday, Wednesday, and Thursday, with clinical labs Monday and Friday during the first semester. Our Tuesday evening class extends until 6:50. All classes start at 8:30. Surgical technology students are required to pass a lab practical exam the first semester with a degree of proficiency at 90% or greater to advance to second semester and our clinical experience. Tuesday, Wednesday, Thursday, Friday, second semester, students scrub in the operating room trying to get those 120 cases that I mentioned earlier, and also to attend our advanced seminar in surgery class. This class helps them prepare for their professional life as a surgical technologist. We perform resume writing and interview and help them create the case log and the background that they need to be successful as a professional surgical technologist. In order to remain in the program, surgical technology students must maintain a grade of 70 percentile or greater and demonstrate safe practice in the operating room environment. Upon completion of the clinical experience and the required 120 scrub cases, as outlined in the surgical technology curriculum, the SurgTech student is eligible to sit for the national certification exam and completion of their associate degree with a concentration in surgical technology. The program costs vary each year. Tuition and fees are established by the State of Connecticut Community College System. MCC students can apply for financial aid by submitting a FAFSA or FAFSA form, which will determine to what extent they qualify for financial assistance. The past 2 years, we have elected to offer virtual books for our surgical technology students with a cost of $189 per student. Uniforms, such as the one you see me wearing, these we call them scrubs, are required on the Hartford Hospital campus. We request that the student purchase 3 scrub sets, tops and bottoms, and 1 scrub jacket for campus wear. All admitted students park on the Hartford Hospital campus and attend classes on the Hartford Hospital campus in the ERC building. The CST Gold Student Exam Bundle is the final cost that they incur, and that this year was $247. This includes not only a 1-year student membership to the Association of Surgical Technologists, which is our national association, but it also includes a review book to prepare them for this all-important CST exam and offers them a one-time opportunity to sit for this exam. Should they be unsuccessful in their first attempt, then they are required to pay for the second exam out of pocket. As stated at the beginning of this information session, I have provided you with an overview of surgical technology and our MCC Hartford Hospital Surgical Technology Program. Please contact me with any additional comments, or questions you may have regarding our surgical technology program. Thank you for your time and your interest in surgical technology, my favorite healthcare career, and my chosen profession. Have a good day.